Okay, I'm Dr. Brian Jenkins. I'm a doctor of chiropractic.
What degree do you have, and why did you decide to get involved in chiropractic?
So my degree is Doctor of Chiropractic. I also have a Bachelor's of Science. I decided to get into chiropractic because I liked math and science. I had had a great experience with a chiropractor as a teenager. And even though I liked healthcare, I liked the idea of treating people. My mom was a registered nurse. I don't like medication, and I never have. And so once I was able to take control of my own health care, I realized I don't like taking pills. So if I had the opportunity to help patients without giving them medication, I wanted to go that route.
Where did you get this degree?
Palmer College of Chiropractic. It's in Davenport, Iowa. It's the very first chiropractic college.
How did you start this practice?
I rented a room from another chiropractor just for a flat fee and just went out and started networking with people and meeting people and just started up from scratch on my own.
What would you say the most challenging part of school was?
Oof, all of it. School was pretty brutal. In the chiropractic, they take a 5-year program and push it down into about 3.5 years. So we were taking 33 credit hour semesters. So we would pretty much get up, go to school, be at school for 8 classes, come home at night at about 6 or 7 at night, have to study until bed, and then right back up and at it the next day. So.
How long have you been a chiropractor?
13 years.
What is the main purpose of this facility?
To get people well.
What is the most common procedure that you perform?
It's probably the Atlas orthogonal percussion instrument that I use here is the Atlas orthogonal technique. Within chiropractic, there are a lot of different techniques, and a lot of people aren't aware of that. Most people, when they think of chiropractors, they just think of the twisting and crunching and popping. But this is a highly specialized technique for adjusting the neck. I am the only board-certified Atlas orthogonist in the Sacramento Valley. There are 3 others that are doing the technique, but I'm the only one that's a certified instructor.
How long does this common procedure take?
You're asking for the treatment of an individual?
Yeah.
We schedule about 8 minutes per patient for the entire visit. On an average, just regular visit, not an exam or a new patient workup.
What is the most rewarding aspect of your career?
Working with kids. A lot of people don't think of chiropractic as working with kids, but I've had tremendous results with autism, with some ADD, ADHD. So being able to change a life of somebody that's very young has been just humbling.
How do most patients pay for their visits?
You know, it's a mixture of cash and insurance. By cash, that means, cash, credit card, check. I'd say probably at least half of my patients just pay on their own out-of-pocket without insurance. I am not on any of the HMOs, so I do accept PPOs. The only one I'm actually on contract with is Blue Shield. Other than that, it's either they're out-of-network benefits or else, like I say, cash.
Okay, thank you for this interview.
Why are you here today?
My lower back hurts, and my shoulder, and my knee.
Left shoulder?
Yeah.
Which knee?
The right knee.
When did the low back pain start?
About 3 weeks ago.
What were you doing?
Lifting boxes.
Any pain, numbness, tingling down the leg?
No.
How about the knee?
No.
No, when did it start?
Oh. About a week ago.
Do you remember doing anything to it?
Mm-mm.
Okay. And the left shoulder?
Probably about 3 weeks, the same as lifting the boxes.
Pain level on everything?
Out of 10?
Mm-hmm.
I would say about 5 on the knee and about 8 on the back. And then about a 7 on the shoulder.
I'm sorry, what was the knee?
A 5.
Okay, so no big traumas, though. You don't remember doing anything that really flared it up?
No.
Okay. Come sit facing me. So with the knee, we can check the integrity of the ligaments really quickly. Don't suspect to find anything here with her because there wasn't a motive injury. Okay, so the ligaments are intact. So now we look at the alignment, and what we see. You want me to go ahead and explain everything I'm finding on you too?
Yeah.
So what we see on her knee, the lower leg has rotated inwards, so we want to bring that around. Correlated with that, we will find tenderness right there, a little tender, and then back there, really tender, yeah? Okay. Whenever we have a knee issue, we want to look at the integrity of the ankle as well. This is called an impulse adjusting instrument. It allows me to move the joint without having to put as big of a thrust into it. Still hurts a little when we hit the tender muscles, though. Sorry. Okay. And with Nicole, then we just like to make sure everything's lined up and moving okay. So the left knee wasn't nearly as bad as the right, but it was also rotated just a little bit. Okay. When we have shoulder issues, we want to go ahead and check wrist and elbow. Those are all pretty good. You said nothing down the legs, right? From the lower back? Okay, good. I keep asking that because with a low back, one of the bigger injuries that we're concerned about would be a herniated disc. And with that, we would get nerve impingement, so we get pain down the leg. Get your face down. So what I'm doing here is looking at leg length disparity. So her left leg is a little short. As we bring it up, it actually comes long, and the right leg is short. Those changes in leg lengths tell me how the pelvis has rotated. Okay, so on her, with the way this is rotated, the left ilium has rotated back on the left, and the right one has rotated forward on the right. That would create this kind of a leg length discrepancy. So we're going to hit this sacrotuberous ligament here, and then the PSIS of the ilium. Correlated with that, then we will hit the sacrum on the right, top of the ilium here, and the ischial tuberosity here. Okay, that's basically just working on taking these and rotating them back the way they should be. So that can be done either with the gun, that can be done the traditional way you expect with the chiropractor, with the on the side and popping it. With Nicole, she does fairly well when we do some of the normal adjusting here in the mid-back. Give just a little thing here, deep breath, and out, and just a little bit there on the right. Deep breath, and out. Excellent. Okay. Deep breath for me, and out. Good. One last one. Deep breath, and out. Good. Okay, sit facing away from me.
Oh.
So I'm feeling for here with the shoulder pain that she's having, we're looking at collarbones. The collarbone on the left is lower than the one on the right. When it comes in here to the claviculosternal joint there, the left humerus has rotated forward on her, forward and down a little bit. Do a little bit more here too. Still a little bit of rotation in the spine. Just want to clean that up. We're going to come in, and this is going to hurt. You know that, right?
Mm-hmm.
That one just hurts because there's no padding. It's basically skin, nerve, and bone. Tender in there?
Yeah.
Okay. So using the muscles of the rotator cuff. But you are tight in there. Let's check your motion. Stand up for me, facing me. So with that arm, do this for me. Okay, any pain?
Just a little bit.
How about there? Anything there?
Yeah.
Come on, come straight up this way. Anything there?
No.
Come down across this way. Okay. Arm's fine?
A little bit.
A little bit. Where's that hurt? Out in?
Like, right there.
Okay. Just come here. Pull it up. Okay. Roll it down. Pain on those? Okay.
Right there.
So you had, go ahead and sit facing away. So you had pain on those. So we have definitely some involvement with the rotator cuff, but no big injury that we're concerned about, or we might have to refer you out. Okay. Oof. Really just some tightness. Rotator cuff, as you recall from your anatomy classes, is a group of muscle, right?
Would that be because I injured that
Yeah.
in dance?
Yeah, you've got that long history of shoulder problems there. So it's left the tissue weaker, more susceptible to other injuries. So I just wanted to check something on you. It's been quite a while since we've worked your shoulders, yeah?
I think we did the last time. We checked it.
Okay. Oh yeah, we did last time, didn't we? Okay. Sorry, it had been a while between that and the last time I worked on it. It's gonna hurt. That's much better. All right, before we move on to your neck, that's out. The last thing we're going to do is using the Atlas orthogonal instrument. Atlas, as you'll all recall, is the top bone of the neck. When Atlas misaligns, it rides up one side or the other, and this causes your head to tilt. Instinctively, you don't walk around like this. You straighten your head up, bring it over center of gravity, so it ends up affecting the entire spine. And so if we can be very precise with the way we adjust Atlas, we can have really good impact on people and how they feel. Well, let's do a leg length check this now. On your back, feet off the end.
Like this?
Yeah, and heels on the back. Just nice and relaxed. Can I borrow one of your cameras? Show you guys this. So what we're looking at here is the leg length disparity here, so we can see that the right leg is about 2 lines shorter than the left. Each line is 1/4 of an inch, so it's about a 1/2 inch short on the right. Okay. That's a postural shift. Okay, it's not that this leg's anatomically short; it's that because of the way she's carrying herself with her head on crooked, it's causing that leg to drop short. That'll be even when we're done. Sit firmly facing me. Right over here. You might want to come around to the other side of the camera. Unlike all the other things that we've done that are so painful, this you don't feel at all. Feeling for swelling back here, right where the C1 and C2 nerve roots exit above and below Atlas. Come on down on your side. Hold it down and forward. Bend your knees. Big deep breath for me. And blow it out. Good. That was it. And sit up. You didn't even scream for the camera. Come on. That's close, but it's not quite perfect. Let's do it again. Big deep breath. Blow it out. Okay. Sit up. Let's get you on your back. Take a look at your leg lengths.
Nice socks.
Thanks.
They're very bright. Slide down just there for me. Too far. That's good.
Hello back.
Thanks. Oh, I just want the heels up. There you go. Act like we've done this before. Okay. So we can get this at the angle. Your toes hang down so much it's hard to see. There we go. There's the angle. So you remember this leg was actually the leg that was short last time. Relax. There we go. Okay, and so now you see actually the leg that was short is a hair long. Okay, maybe about 1/16 to 1/8 of an inch long. Okay, and we'll see that because the leg that was tight and pulled up in that posture, just with the relaxation of the body, but oftentimes the leg that is short we'll see come on. Okay, that's it. That's all your treatment.
Thank you.